Universal health coverage remains one of the government's biggest promises. But in Turkana County, one of Kenya's most remote and underserved regions, that promise is still just words on paper. For decades, successive governments have vowed to deliver quality healthcare for all, yet entire communities continue to be left behind. The consequences of 4 decades of broken promises are written in the lives of children vaccinated and treated under trees after their mothers walk miles in search of medical care. Nowhere is the price of a failing health system more visible than in Turkana. Tonight, Citizen TV reveals the hidden face of Kenya's healthcare crisis. In Turkana, Akangatukisio is traditionally known as a place where people gather for meetings or to discuss community matters. But this gathering is different. Under the limited shade of thorny ancient trees, women and children seek healthcare services. Most of these children have small frames, revealing the harsh realities they face. Many are stunted and wasted, their bodies too short or too thin for their age. Many opt to depend on outreach clinics such as these, as the nearest hospital is Lokitang Sub-County Hospital, which is 190 kilometers away.
The common conditions that are treated in this place are 1, malaria, of which there is a high increase of malaria as we talk right now. Because if you even take a test, MRD test meant for malaria, all of them tend to be positive. The second one is upper respiratory tract infections, mostly brought by the changes in weather. And then it is also related to the water they are taking.
On a closer look, many of the mothers here are teenagers.
As per the malnutrition cases, currently the source of livelihood of the community around is fishing. They are now vulnerable. Fish are not available totally. The animals they used to be having, all of them have died.
In this fishing community, where poverty runs deep and livelihoods are uncertain, young girls often fall victim to exploitation, sometimes in exchange for fish, food, or basic necessities. The result is a cycle of early pregnancy, lost education, and lifelong poverty.
For children with severe acute malnutrition, without medical complication, we admit them in the outpatient therapeutic program. We give them routine medication, which is amoxicillin, and then we give them plumpy nuts. They're ready-to-use therapeutic feeds that they use at home. For the severe acute malnourished children with medical complications, those we don't treat as OTP cases. We normally refer them to the stabilization center for inpatient management.
For decades, Kenya's healthcare journey has been a road paved with promises, but riddled with corruption and inequality. Under President Moi, ambitious health pledges were swallowed by scandals like the Nyayo ambulance procurement fraud. President Kibaki's Vision 2030 largely bypassed remote counties like Turkana on health reforms. Under President Uhuru Kenyatta, the Linda Mama initiative promised free maternity care. But today, the program is crippled. Now, under President Ruto, the transition to the Social Health Authority SHA, which was billed as a reform, has brought more bureaucracy than relief. For now, this remains the situation for Kenyans seeking health services under trees. This is not just a health crisis, it is a test of national conscience. What you're seeing here is communities and especially mothers trekking kilometers with their young children in search of outreach programs such as these. What we're seeing here is just but a glimpse of the enormity of the situation on the ground. Lillian Muli, Citizen TV in Turkana County.